to order. Good. Okay. If you could do roll call, please.
Miller.
Here. Here.
I heard you, Mary. Kramer.
Here.
Glassburner.
Here.
Harwick. Harwick.
She started, didn't know.
Here.
There we go.
McGuire. Barris.
Here.
Braithwaite.
Here.
Dicker. Here. You have 7 for a quorum then.
Awesome. Okay, and we are in compliance with oath of people.
Yes.
Okay, we have an 11-point agenda. Do I have a motion to approve that agenda?
I so move. Okay, then I'll second.
Okay, motion by Ticker, second by Braithwaite. All those in favor, please say aye.
Aye. Aye.
Opposed? Okay, minutes from last month. Any corrections or changes that you guys noticed? If not, we'll say those are approved and we'll move on to public comment. Is there anyone here from the public who wishes to speak in person or online? All right, that takes us to number 7, reports. A, Health and Human Services Director Administrative Report.
Okay, so I do have our unit updates in the folder, a couple of things I want to highlight. At the end of January, the ADRC participated in the National Point in Time Count. This is a count that is done to track how many homeless we have in our community. And this year, on that date, we found 18. So this is shared with those that oversee funding to ensure that proper funding is provided to the counties. The other thing that the ADRC is focusing on this year is helping individuals complete their power of attorney for healthcare. So this is something that impacts our office, impacts the hospital. If people do not have their power of attorney for healthcare set up, it does lead to need for guardianship. It can put people in a position where we have to rush to get court hearings set up, to get temporary guardianship, to provide services to individuals. And so it's really important that we make a push in this community to get people that, their power of attorney for healthcare set up. One of the things that, I lost my train of thought. Oh, it's really about also individuals having decisions about their care after they're unable to make decisions. So we really want to make sure that everybody has those set up. So our Care Coalition is taking the lead on this and are providing education on how to help people fill out their power of attorney for healthcare, and then also getting them filled out, because there does need to be 2 individuals that witness their form and confirm that that is what they want to see happen. In our Child and Youth Services, one of the things I really do want to highlight, in 2024, our unit really focused on trying to obtain reunification. When I started, we had 5 children that were in care for a lengthy period of time. We did find permanence for those 5 children in the past year. 3 returned home to a parent, and the other 2 went to permanence through guardianship or through TPR and adoption, which is termination of parental rights and adoption. This was something that was a focus starting in 2023 when I started really digging into it. So there are 5 children who will be out of our placement report. We always add others, but 5 children that had been left in limbo for a long time and we achieved permanence. So I do want to do a shout out to that unit for the hard work they did this past year in regards to that. In our behavioral health unit, it continues to be busy. I hate using that word, but there's a high need for mental health services in the community, whether it be referrals for psychiatric care, medication management, mental health care. Those are all things that continue to be a need in the community. We continue to provide it as best we can. We do have with some of our providers a long wait for them to get in. I talked with our psychiatric nurse, and for someone to get into our psychologist, we're booking up till May. So it does take a while to get in. Granted, they're not full-time positions. It really is about what we can provide. So we are providing that service. There's just a little bit of a delay. Also in December, our crisis was very busy. As you can see, there were 43 Northwest Connection notes. So Northwest Connections is the agency that does our after-hours crisis response. That was 11% of the calls for the year, so that's a decent amount. It was a month with lots of things going on for that unit. And then our adult protective services, you'll see that through the entire year of 2024, they had 222 APS reports that were made. The previous year was 118. So there was almost double the amount of reports made for adult protective services in 24 versus 23. And then we did have a resignation in our economic support unit, so have just started advertising to fill that position. Across the agency, we are working on wrapping up the job description, so that's been a big focus the last couple of weeks, is trying to get those completed. We're also been working on the Tyler rollout, so something I've been doing the trainings. The first go live date is the 17th of this month, so we're pretty excited about that. One of the things, just to give you a heads up on, next month our reports may look a little different, or we may not have reports, depending on our understanding of the system, I guess is probably the best way to put it. So we just really want to make sure that when we're sharing you a report, it's as accurate as it can be. And if we don't fully understand how it looks in the system, we might just delay reports for 1 month. The last thing I want to talk about is possible cuts to Medicaid. So that's one of the things that's on the federal level, and it is something that we're very concerned about. A lot of our mental health care is Medicaid funded, and we do worry if we don't have the same amount of Medicaid services and funding, that will impact people, that will increase our emergency detentions, that will increase the needs of the community. A lot of our programs really are to keep people safe and in the community, so we're concerned about that. We're concerned about it through our Aging and Disability Resource Center and APS. A lot of their funding is Medicaid funding. We have individuals who get home and community-based services, which keep them in the home, keep them out of nursing homes, keep them out of more restrictive settings, that if there are cuts to Medicaid, it could potentially impact them. So then there's more concerns with people in their home, being unsafe in their home, or having to go to a more restrictive setting, which is a concern for us, and ultimately results in more costs on the back end. Our children's long-term support program is Medicaid funded. Children's foster care is Medicaid funded, not the foster care, but the Medicaid insurance that is provided to them. So it is something that we are watching and that we are doing advocacy for. And if you have questions or wonder what to do or how to advocate for people, we can provide you information. We can provide you talking points. At some point in time, we might bring to this committee a resolution to take to full county board, supporting Medicaid standing as it is and not making cuts to Medicaid. The other thing that we were concerned with when the federal grant funding froze, federal grants were frozen for about a 24-hour time period, that would have impacted our economic support unit, our ADRC and aging programs, our behavioral health unit, and our children's unit. So that would have had far-reaching implications for us. So there's a lot on the national level that we are watching for, that we're monitoring, and we're really being alert about.
Thank you. Does anybody on the committee have any questions, comments?
I'd like to ask Tracy a question.
Yeah.
Is Pine, like senior citizens going to Pine Valley, are they included in that adult protective services?
Sometimes they are. So sometimes individuals need to be under a protective placement, which means they have to be placed somewhere so that they can get their needs met and are safe. And at times, Pine Valley is the location where the protective placement could be, or it could be in an adult family home, a CBRF, and RCAC, excuse me. It can be many different places, but Pine Valley is one option where they do have protective placements.
Thank you.
Yeah.
Anyone
I
else?
guess I do. Earlier you talked about something that doubled from 20.
Our adult protective
Yeah.
service reports.
Why suddenly increase? Or what caused that? Just life and living.
I don't know. I don't know if you have any insight in regards to that. We're just really not sure if it's a anomaly of a year and that our numbers will change this year. I don't know. The other thing could be we've had a consistent adult protective service worker for all of 2024. Cindy's been in that position the whole year. Part of it may be that they just had very accurate tracking where historically maybe there wasn't. Honestly, I don't know. So it's really something we're watching in 2025 because if that trend continues, we may have to look to add a position.
Population is equal.
Right.
Aging population too, yeah.
I had a question on the homelessness. I didn't know our number was that, I mean, that seems high for our small community. Is that an increase or has it been?
We normally don't find people in the winter. So
Right.
summer, we can find anywhere from upper 20s to close to 50 people. So those individuals that we counted were, some of them were at Passages or Child's Place or housed through Lydia's house. There was actually 4 people that had no place to go that we
Wow.
actually found. So I think it's one of those things that people don't think about because we're a small rural county and you don't see people.
Mhm.
You know, they're living in campers, dilapidated campers, you know, things like that. And people just don't realize, because I think we're so rural people, it's something that's just never talked about. But it actually, we see people on a weekly basis that come in. We actually had somebody this morning that we're working with that's homeless and that we're gonna try to get her to La Crosse because she's got family in Eau Claire. So we actually see it frequently.
Well, thank you. If there are no other questions, we'll move on to the HHS expenditures report.
It's online. I don't know. Did I put it out there? Expenditure report?
Yeah, it's on there. If there's not, I mean, it's one of those things we just need to
Oh,
look at.
all right.
If you didn't have something to
Yeah, it's
highlight.
on there. I don't, the only thing, you might notice, for our 2024 vouchers, we were able to purchase the computers that we had taken through. So should be good to go for a few years for the staff that was lucky enough to get one of those. So that was a pretty high thing. You'll see we had a lot of 2024 yet, a few 2025 starts to roll in. Next month, it'll probably flip. Shouldn't see very many 2024. Those are winding down. Books close March 15th. So we're trying to get those in there and get those paid as soon as possible. And that's another thing, Tyler, there's gonna be a delay there too. So hopefully we'll be able to cut checks next week, but not next week, week the 17th, but we'll see. So we're trying to get as much done the next couple of weeks as possible. So next month, you'll see that switch over. Otherwise, other than the computers, nothing really jumps out at me.
The computers were the JCOM
The
technology.
JCOM technology.
Yeah, and that was what we were using the rest of the funding for. Is that
Some of
correct?
it.
Some of it was.
Some of it was, yes, some of it, a couple of were purchased through CCS, a couple through the ADRC had some carryover from years ago. That's just sitting there that we're trying to use up. But yeah, otherwise some of it came out of ARPA. County of Dane, that $2,000, that's for us to pay for them to do our childcare fraud. Michael Marshall Carpentry, that was ARPA, that's $980. That was an ARPA. We had to, with the new refrigerator in public health, they had to tweak some things with the electrical, right?
It was to make sure that all the refrigerators were on the generators, so the generators power,
Yeah.
they stayed.
But we took that out of ARPA as well, so as much as we can put on that, we're going to while it lasts. And the purchasing card, nothing, the usual CLTS. Background checks, things like that.
Says 2024 HHS budget summary and placement report. It looks like we've got our placement numbers through December now.
Yes, we do, yes, yep. And we're gonna land just under.
I see that.
Correct. I don't see that fluctuating too much. We still have a couple of our, I think October, November, adult, community residential placement numbers might change a little bit, but not much. So it's gonna land right around where it should land, for adult placements. And then for children's, yeah, that's gonna come in better than we had anticipated. We thought it was gonna be a little higher than that.
And at this point, the extra money in that fund is still goes back to general fund, right?
Currently, it's staying in these.
Oh, it is
funds.
staying in these funds. I wasn't sure if we
Yes.
had, okay.
Not, yes, I think the goal is to keep these funds.
Well, I knew we had that goal. I didn't know if we were there yet because.
We're close. We're
Okay.
close. We're close. These are the budget balances. I'd have to pull up the cash balance that's in there. To kind of see where we would be. Since I think we still need a little more cash in there
Okay,
in these funds, but the budgets look good, so, yeah, so. But yeah, but if there's not a lot of carryover in the budget, not enough left in the budget, that means that cash balance is just gonna grow that much slower. So-
right,
But yes, we're getting there.
okay.
Got that recently, so. And then as for the actual budget itself, 2024, I mean, I hesitate to say these are final, but they might be final, depending on, like Tricia said earlier, depending on how I can get the reports pulled for next month. But if they're not final, they're pretty darn close to being what it's gonna be. We are looking at a surplus, that's primarily from WINCR dollars. We received more WINCR dollars than that were budgeted, which was super helpful. And then you'll see in a couple of the departments, we were high, but public health again, that was ARPA spending. We didn't budget to spend any of that money because we just figured we wouldn't. And then when the state said you can please spend it, well, then obviously we had to pay for it out of somebody's account. So it just happened to be public health. So, but that's all been reimbursed. So, so that 47% over is been 100% covered by ARPA. Elderly services, a little bit over, but not sure why. Transportation, yes. Yep. And then the other one, the CCS program, as you can see, that increased drastically there. The thing about the CCS program though is we will get that back, but we won't get that back until maybe December of this year.
And did we did increase the budget in that, didn't we, for this coming?
I don't remember if I did or not. Usually
I thought maybe because it was expanding, but I'm
Yeah.
not sure if we.
I may have, I'd have to look at what I put in for 2025, but yeah. Yeah, it gets a little tricky when you're like, you're seeing your average, but then you're
Right.
trying to project. And if I had seen these numbers back in May when we budgeted, I probably would have upped that, but
Yeah.
I wasn't seeing them until October, November, by then it's too late, so. That's something definitely to think about for 2026.
Yeah.
So yeah, but to come in still with a surplus is good.
Well, we like that.
Yeah, for sure. We'll take it.
Yeah.
It's just not as high as we've seen the last couple of years, so it's like, oh man. So,
Any questions for her on this final budget summary?
That ARPA money, that was COVID money, isn't it?
yes,
Is that done this year or is
It was due to be done, right?
It was supposed,
2025?
it was supposed to be done at the end of 24 and they gave us an extension to the.
Oh, they
end of
did?
25.
I did not know that.
Yes.
So do we still have funds left?
Yes.
Still do.
How much?
yes, I want to say around 46,000.
Oh, nice.
I think that was my last look, but.
Well, that's a nice little cushion if you.
We're meeting with Trish and Public Health and we're gonna relook at the spending plan, because I haven't shared that in a while, so maybe that's something we could do next month.
Yeah.
We could see where that landed and I can report out on the ARPA to do
Okay.
that. What the balance
I
is
don't think
at.
we can complain about having a little bit more money.
Aw. So which felt good because we were kind of getting to the end of the year, like, oh my gosh, we're not spending this.
Right.
So it kind of put a little bit of.
Well, they probably had a lot of agencies in the same spot. So.
Correct, yes. So yes, so we did get notice that they're gonna let us carry that over and they're gonna redo the contracts, but yeah, I can't remember what my balance.
Now, was that specifically for your department or is that for anybody with ARPA?
Well, that I didn't know.
That, I'm not sure.
You mean as far as the county?
Yeah.
Fund 93?
Yeah, I haven't heard anything about it in a while, so I didn't realize they'd given you guys an extension. It makes me wonder.
I don't think the county's ARPA and I might be wrong, but I believe that it was you can use it through the end of 2025, but it at least had to be allocated at the end of
Okay.
24. I believe that's when the highway project home.
Yeah,
The funds were allocated to that.
I think you're right.
Because I believe before Larry left, he was trying, he was making a mad, yeah. It was a bad project to try and get that allocated out so he could tell the state where, kind of like our spending plan, right?
Right.
Like, what are you gonna spend it on? You can have it. And the difference between the county though is the county already has all their money sitting there, right? We don't have the money. We have to claim it after we can show you
Okay.
the stats. So it's a little different, but
Okay.
yeah. But as you know, ours didn't have to be used on just HHS. We used it for other things as well.
Thank you. Any questions? Okay, E, Child Support Quarterly Report, and I see Melanie Walters was online.
Yes, can you hear me okay?
Oh, yeah.
Hi.
Thank you. I'm gonna leave my camera off. I'm working from home due to illness and I'm not really camera ready today, so.
Okay, well, thanks for showing up.
Sure. All right, so our report is from October to December to finish out the calendar year. We met all of our benchmarks for October to December. With the exception of the arrears collection. And again, that's the one that is set back to 0% on October 1st. And then we have until September 30th to reach that 80% benchmark. So right now we're at 61.89, which is very good considering that, you know, we're halfway through. As far as training, we're continuing to work with the partner training team and other agencies to kind of learn best practices. We have had some agencies that have provided us some document templates of things that they've used to kind of help us out to see if it's something that would work in our agency. Charlene has started her alternate care case training that has to do with foster care and kinship care cases that refer over to us. She started that last month. And then I am continuing my new director training. And there are virtual meetings that are held each month on that. Our budget reports are as of December 31st. I had until the 23rd to do our final claim for 2024. We do our claims monthly, but we're paid quarterly. So when we receive this last payment, it will be for the last quarter of 2024 and should be posted as revenue for 2024. As of December 31st, we only utilized 80% of our budgeted monies for expenses. There are a few straggler bills that will be coming in for 2024. Not too many. We're expecting most of them to be for service process when we request other county sheriff's departments serve case participants for us. And then this year, the child support program turns 50 years old. President Ford signed the Social Services Amendment, which created the federal child support program as we know it today. Our agency received updated office furniture that was out at the UW campus. I would encourage you, if you have a minute, pop down and look at it. We're very happy with the look of it. It is very nice to have uniform looking office furniture. My desk before was pieces of 3 separate desks put together and it didn't match and they were different heights. So it is nice to have it's a nice flow in the office, let's say that. Since we only utilized 80% of our budget, before Candace left, I spoke with her and then again with Interim Administrator Kalish about since we got this new furniture, maybe doing a few more updates to our office and utilizing some of that 2024 funds that we had left over, and they had approved it as long as the expense wasn't crazy. So we purchased new privacy panels for our desks, so when people walk in the office, they can't see what we're working on for the confidentiality aspect. We had to get some small locking filing cabinets. We could not utilize any of the filing cabinets out from the campus because they cannot find the keys for them. And per the regulations for our office, all of our filing cabinets have to lock. So we did have to purchase those. We got some desk organizers, some new computer monitor stands, and I estimate the expense around $600. Then we have a back office in our agency. It was an office for our attorney, but after discussing it with attorney forehand, she's like, I don't really utilize the space because I have my own office in the DA's office. So we had that furniture removed out of there. The plan is to work with Randy to identify if there's any furniture such as like table and chairs, things like that, that would fit back there because we would like to make it into a confidential meeting room. We do paternity interviews, genetic testing, and right now we have to have people cram themselves into our small space inside the office door. We have to shut our office down because they're confidential appointments. This would allow us a separate space to meet with people while letting the office flow continue for other participants to come in and be helped. So that'll be something we'll be working on this year. Cooperative agreements, we have those with the clerk of court office and the family court commissioner for work that they do with our agency. And then the expenses they incur for working with our agency, we get reimbursed 66% of those expenses through these cooperative agreements. Those have been drafted, sent off to the clerk of court and the family court commissioner to review and sign. Clerk of court has sent theirs back. I'm just waiting for the family court commissioner to send those back, and then those will get filed with the state, and the deadline for that is March 1st. Prior to Administrator Pesch leaving, she did sign the contract between the Wisconsin Department of Children and Family, or DCF, and our agency to continue for Richland County to do child support services in 2025. This is a contract that is signed with the state every single year. And then I'm working with Attorney Wendell to update our agency's policy and procedure manual. In reviewing it, it hasn't been updated in quite a while. There's things in there that they're either obsolete because of technology updates or we've changed our policy. So as we work through this manual, there could be some things that need to come to the committee for input. So does anyone have any questions for me?
Doesn't look like it. Thank you, Melanie. I really appreciate you giving that report.
Thank you.
I hope you feel better.
Thank you.
That will take us to 8, discussion and possible action, resolution approving amendments to 2 2024 provider contracts for the HHS.
So these two contracts, we found when we got towards the end of the year that we were going to go over. So the first is Diane's adult family home. We do have one individual through the CCS program placed there, so we do need to increase that amount. And then Fiscal Assistance Incorporated is the vendor that processes the payments for the children's long-term support program. So that's all pass-through funding. That isn't any money that comes out of county levy, but we do need to increase these contracts for 2024.
Okay. Unless you guys have any questions, you can see that 8B document is the resolution then. We'll just need a motion and a second so we can vote on that.
I'll make the motion.
I'll second.
Was that Sandy?
I said I'd make the motion.
Okay, so it's Sandy and then Michelle. Thank you, ladies. Any further discussion or questions? Okay, if not, all those in favor, please say aye.
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 Any opposed? Okay, it takes us to number 9. Do we have any correspondence?
Do not.
Okay. And future agenda items, we talked about adding the spending. What was it that you said? Yeah.
Do you want that to be like discussion possible action on our expenditure?
I don't know if there'd be any action. It was
Just a report.
Reports, yeah.
Just to kind of update you on the balance and what's in there.
The ARPA expenditure?
Or our first spending plan.
I'm calling it the spending plan.
Any other things that you would?
Yeah, so we did, I completed a survey of HHS employees, so I will bring back the survey results.
Great.
So we'll do that next month. We will present the organization chart and our contract monitoring report.
Okay,
There won't be much contracts to
Right.
monitor, but at least you'll get an idea of all the contracts that we have put in place for 2025.
okay.
And those can all go under the reports.
Anything from anybody on the committee? All right, that sounds great. Thank you. Our next meeting then, be March 6th. So I have a motion to adjourn to March 6th at 9:30.
Okay, I'll do that.
Thank you.
And I'll
Francis.
second.
Second by Cindy. All those in favor, please say aye.
Aye.
Any opposed? Have a great day, everybody. Thank you for joining online, ladies.
Good
Thank
night.
you.
Bye-bye.
Bye-bye.
Yeah.